Is this a gamble, this policy?
I think we're all gambling to a certain extent right now. I mean, the countries doing lockdowns are also gambling because nobody knows what the effect of a lockdown will have on this pandemic we're seeing right now. So we're all gambling more or less. I think in Sweden, probably we're gambling less because we are using methods that we are used to in Sweden. We are following laws and regulations that are, communicable disease law, and we're following a tradition in running things in a sustainable way so that we will not have to change course too many times over this pandemic.
Yeah, a lot of people are confused about this because they think that if everybody's gambling, then surely you gamble on the side of caution rather than gamble on the side of throwing people out there and sort of seeing where the cards lie. But it seems as if you've invested in this idea of herd immunity. Is herd immunity working? Is there evidence thus far that it's actually happening?
We are a bit early to say something about that, but what we can say is that we see a very clear leveling off of the number of cases in the Stockholm and surrounding areas. And in the last week or so, we also see the diminishing amount of cases coming into intensive care, diminishing amount of cases entering the hospitals. And so that, I think, to a certain extent, probably is depending on that we have an immunity in the population now that slows down the spread of the virus in the Swedish society.
Sweden's 2,586 deaths, of course it's more now, compare poorly with Denmark's 452 and Norway's 207.
Yeah, I mean, there are different parts to that question. First of all, we are in different parts of the epidemic, and we don't really know where we're going to end up until this is all over. And that's going to take probably years from now before we know that for sure. The second part of it is that, unfortunately, we got a lot of cases in our elderly homes in Sweden. And that's, to a certain extent, is a separate issue because we're trying a number of measures in those homes, and we see that they are paying off to a certain extent. So, and there is a lot of other things to this than the death toll, even if death toll is always regrettable. I mean, having a lockdown with children not going to school is causing a lot of consequences for children. Having a lockdown and people not being able to see each other also causes a lot of consequences to people. Having a lockdown, a lot of people losing their jobs will also have a lot of public health consequences. So I think it's going to be a time for reckoning and seeing the complete effect of this in the long term. But it's far too early. And I think Sweden's death toll compares favorably to many places. New York in the US, for example, Belgium, Netherlands, UK, a number of countries in Europe. So this is not an easy disease to have any clear answers to yet.
Dr. Tegnell, are you confident enough to say that other countries that have harshly locked down are wrong?
No, I don't think anybody is going to come out of this. We can say that they did something wrong because this is a very complicated situation. And you need to do and use the tools that you have in place in your country to make the best of it. And that's what we have done in Sweden, and that's what we continue to do because we continue to look at the situation, see what more things we need to put in place, and maybe what things we now can ease up on when we see the diminishing amount of cases.
Yeah, as we heard from Michael J. Ryan from the World Health Organization in Natalie's report in the preamble to this discussion, he said that Sweden represents a future model. He didn't say now, but it represents a model that perhaps other countries can sort of map and copy later on. Would you advise other countries to copy your model now, to follow your example, or is this only custom made for Sweden because Sweden has a particular set of parameters that you are working within?
I think we all can learn from each other in this situation, and I think there are things to learn from Sweden, and I think countries are already learning from Sweden. I think now a number of countries are opening up their schools, and I think, at least to a certain extent, that's based on our experience in Sweden, where schools have not proven to be the engine, the motor of this pandemic. Rather the opposite. We have extremely few cases in schools, and we don't have many cases among children, among parents and teachers either. So I think this is really a time where we can work together and learn from each other.
It seems as if you have a policy where, unless your symptoms are extremely severe, even if you are diagnosed with COVID-19, then you're not hospitalized. Is that a policy that you believe is the right one?
I think no country will hospitalize people who are not sick enough to benefit from hospital care. I mean, that doesn't make sense in resources. I think the situation in Sweden is very different. We tell everybody to stay home. With the slightest symptoms in the morning, stay home and see what they develop to. And I think that's part of the reason why we now have a fairly flat curve and why we have a curve that's even slowing down, is that people are really staying home when they feel the slightest symptoms. And I think that takes away a lot of the contagion in the society.
One of the reasons why I ask you is because you would be aware of the case of Emrullah Gülüşken, a Turkish national who had to be evacuated from Sweden by Turkish authorities in a Turkish air ambulance after his daughter made an appeal on social media. When you see that somebody who's sick with COVID-19 has to be evacuated to another country, does it embarrass you or not?
I wouldn't comment on the individual cases, but let me say like this, that at any given time there's been at least 20% empty intensive care beds in Sweden. Nobody in the need of healthcare or in the need of intensive care in Sweden has been denied it, and that is including citizens from other countries.
Anders Tegnell, pleasure having you on the Newsmakers. I thank you very much for joining us.
Thank you.